Thank you for being here tonight. It's a pleasure to introduce Carrie Coen, who's the Director of Summit Therapy and Health Services of Pullman Regional Hospital. She's been with us 6 years now, and she has her doctorate in physical therapy. She's a wonderful leader in our organization. We're grateful to have her be a part of the implementation of our Telespeech service in cooperation with Gemini Systems. Bryan Kasbar is the president of Gemini Systems. Bryan got his BA in economics at Yale, and he's served as a CPA. When you see Bryan stand up, you'll understand that he was a collegiate athlete, played basketball at Yale, and you'll understand that goes with the stature that he brings to the podium. So please join me in welcoming Carrie Coen and Bryan Kasbar.
I'm going to put the mic way down, and when Bryan gets up, he's going to put the mic way up here. So I'm grateful to have the opportunity to visit with you for just a few minutes about our Telespeech program. When I first met Bryan and his team from Gemini a couple of years ago, about 2 years ago now, it was during a presentation that one of our speech therapists had asked him to come down and do about their product. And I was sitting there thinking, oh my goodness, this is amazing. This is overwhelming. We've got to be part of this. Somehow we've got to be able to partner with them to do something. And about a year went by before we really began that partnership, but during that entire time I kept thinking, somehow we need to work together. And today we are, so that's fantastic. So I have just as much passion about the program now as I did a few years ago. It's just nice to see something coming of it. So at that time, I didn't think about the fact that our partnership and what we were going to do together was innovative. I just thought that it was a brilliant idea. But the more I've stewed about that and with the development of our new innovation program in the last year, it's really become apparent that it is an innovative type of an activity. So if I think about innovation in the 5 categories of innovation, Gemini Systems and Pullman Regional Hospital really fit that definition. So the top tier of all innovators only make up 2.5% of the entire group of any innovation that goes around any idea or a product. That's a good place for us to be. You know, the people that are in that top tier are prime innovators. I would describe Bryan and his family and their Gemini Systems as being those prime innovators. They're really those brave people that are kind of pulling the change. I'd like to say that maybe that's us too in some way, because we're helping them develop that. We've gone along with them and our partners in trying to make this speech system, which Bryan will describe in much more detail in a few minutes, really come to fruition for us, for the children that we work with, and has a lot of potential for many other things in the future. So in the healthcare industry, or in the health industry, as Scott pointed out, being in the top 2.5% of all of the people that are leading change through innovation really puts us in a position to do some amazing things. And it will not only alter the way we do business, it will alter the way the patients and the people that we care for in converse doing business with us. So because our speech team could not be here tonight, but they're really the ones that run the entire show with us. They're the people who make this happen. Our marketing department has put together a really nice video to kind of let you hear from them in terms of how they feel about what we're doing with all Telespeech, not necessarily just what we're doing with Gemini, and how innovative that is.
I'm Carrie Cohen, and I'm Director of Summit Therapy and Health Services. One of the biggest things I think is the time that we can save in things like traveling to and from homes, to and from school districts, even taking patients from the waiting room back to the treatment area. If we can save even that little bit of time, that allows our speech and language therapists to have time to add to the service, to do documentation, and to do things that are much more productive.
I've really enjoyed the teletherapy model because it has broken down some of the barriers that we might face as a practitioner or as a patient.
Currently, right now, we're working with the Pullman School District, and within that, I am working with 2 speech therapists, and it will branch over 3 schools this year, which is an increase from last year. It's kind of exciting to experience working with more than one school, and so we'll have the opportunity to work with grade schools as well as a high school this year.
Our biggest partner is Gemini Systems out of Spokane, Washington. Bryan and Laura Kasbar, who are the founders of that company, have known us for several years, and we've been working with them to develop our speech and language platform.
We would like to increase the scope of our practices, possibly with school districts that are in areas of the state in which they have difficulty hiring a speech therapist.
Most kids are very technological these days, and they seem to really light up when they're invited to use technology in this way. Not only can we see children in their homes, but we can follow them around their natural environments, whatever environment that is, be it daycare, schools. We have a feeding and growth team right now, and we're trying to evaluate a child's ability to eat in their family setting. What better way to do that than to be like a virtual family member?
In terms of patient privacy, I'm not worried at all. The video system that we're using, the platform is not terribly expensive per month, but it does have very high quality HIPAA standards already built into it. In looking beyond that, there's a huge variety of applications that we can use here in our department, including exclusively using it for genetic counseling as well as health psychology. And in addition to that, there's applications that can be partially used for occupational therapy, physical therapy, and audiology. It really is going to be, I think, something that is groundbreaking in terms of what speech and language therapy is going to look like, not only here in our country, but all over the world.
With that, I'd like to turn the mic over to Bryan Kasbar, who will explain his amazing and exciting program to you.
So thank you. Just to carry on to some of those comments, quite literally, I travel hundreds of thousands of miles this year speaking to different hospitals and clinics. You're not in the 2.5%, you're the top. Really, of all I've been to Yale, Princeton, UCLA, UCSD, and I haven't met a group this dedicated to innovation. I'll get to that a little bit later. The efficiencies become obvious when you look at using video as therapy. 30% of traditional delivery of speech therapy is done repetitively with flashcards or other means. The other 70% is all of those human things that'll motivate a kid. Video's been shown for 30 years of study to be even more effective in those repetitive tasks. There's just been no way to automate it and customize it. So we have built a platform that's got 15,000 therapeutic elements that are like iTunes, and a therapist can make a playlist for a kid and assign it over the internet, and that child would have unlimited repetitive therapy anywhere there's internet. So a child, they don't have to drive 2 hours out into the far reaches of the county. They can simply assign it over the internet and the child can work. And so we've done that as a platform, but we also, my wife has just an incredible intuition. She developed for our own child who had autism a way to strip down all of the information visually so that it looks like an Apple commercial before Apple commercials came around in the year 2000. White screen, stripping all the unessential information in. And not only do we have a platform to use video, but this video seems to be doing something neurologically that's exciting some of the top researchers in the world, and we're seeing a lot of unexpected things happen. One of the unexpected things happened in a clinical trial in Spokane where we had a bunch of classrooms and we didn't tell the other therapists that we were doing it. We simply told the teachers in the classroom, and the PT walked in and said this, which is the next slide.
But the last month, I was working with a group of kids, and all of a sudden my children that absolutely were usually spinning and running and doing all the craziness, they were watching what I was doing, and they were modeling the exact body movements that I was doing, which are not easy for their bodies. And so I kind of went, okay, something is different, something is going on. I need to find out what's going on because these kids are different than they were a month ago. So I go talk to Ellie, and she said, Gemini. Gemini's what we're doing. And so I went and I watched the videos, and I'm like, there's no way that this video can have this kind of carryover in gross motor. How is that possible? But it's possible because it's happening, and I'm seeing it every day now. It's great.
So I spoke with some neurologists, and I can't go exactly into why, but what they said was because of the way you're teaching, because it's familiar and repetitive and bite-sized piece of information, you may be actually teaching directly into a much deeper part of the brain called the basal ganglia, which is a healthy part of the brain, and not to the prefrontal cortex, which is damaged in children with autism and with cerebral palsy and with perhaps traumatic brain injury, cardiovascular accident. And that maybe that healthy part of the brain is what's creating these spectacular results that we're seeing. So I wanted to go over some of the results. Well, first, we've gotten the attention of a lot of neurologists. Our biggest supporter from early on, next slide, is Dr. Mobley, who runs he's the chair of the Department of Neurosciences at UCSD, which is a top program. And if you go to the next slide, he's come out and just said, if it works as we think it might, it will represent a significant advance for teaching language to special needs children. The results we saw are not incremental. They're game-changing. This next slide is what my own son did 14 years ago. His expected language when he was 8 years old, we expected to have a language of about a 2-year-old. Once we introduced this way of teaching, these were his language gains. He gained against his neurotypical peers, which doesn't happen in autism. He crossed the mean. He's now 17. He's at Spokane Falls Community College and the lead in his class in French. So a nonverbal child is now bilingual. So with this, we went into the Spokane Public Schools and did a randomized clinical trial. And the next slide will show you that as we did this, these are minimally verbal children. In the 3rd week, we started getting average gains among the population of expressive language, 12 novel expressive words per week. In the minimally verbal kids, 10 expressive words. And in nonverbal 6-year-olds who had never spoken, 3 weeks in, they were learning 2 expressive words per week. So we're seeing this over and over and over again. Kids who were non-responsive to traditional therapy, something's happening neurologically. We don't really know what, but the neurologists are excited. We saw these kind of gains in IEP, which is just their traditional, if the next slide. Some of the kids we were teaching targets they'd been working on from September to May. They were trying to know their colors or their 1 to 6. Before the test, after all the months of schooling, these were their knowledges expressively, and after 1 week, that was their knowledge expressively. Again, it's not incremental. It's pretty spectacular what's happening. We took these results, which are going to be published in January. I kind of want to pull the curtain back and show you into the future on the things that we're publishing. This will be published in January. We then took these results to the treatment team at Autism Speaks and said, this is pretty stunning. And they said, well, could you do a crossover design against other video, which we know that works, in a school setting, double blind, with independent data collector, just the full 9 yards. So we did that in Inglewood, California, which is a bankrupt school district. We tried to pick the hardest district we could work in. And the next study shows that teaching words against other videos, we actually could teach 41% of the targets that were given to the children in a week, where the other could only teach 13% of the targets. So about 3 to 4 times faster, which was very exciting. And we're following up on that. One of the things that's happened, and when I say, and when Carrie says that this is going to change the way it's done in the world, as soon as we knew our clinical trials were going to be published, we went public. Dr. Mobley said, wait till the clinical trials are out. And just through Facebook, we've been available for 2 months. And the next map, we asked our staff to map the last 500 people that signed up for service from us. And that's a map of where they all come from. So based in Spokane, Washington, we have clinics in Cape Town. I spoke with a mother in the city of Maun, in the Okavango Delta of Botswana, Malaysia. We're speaking with the Hashemite court in Jordan about bringing it there. So there's a lot of excitement internationally about this. And the first team that's going to use teletherapy in conjunction with it is going to be the team at Pullman. So it really is going to affect the way it's delivered in the world, and it's very exciting. Here, of those dots, I'll just pull some of the dots out. In the United States, in Bridgeport, Connecticut, United Cerebral Palsy Center was using it with a 12-year-old boy who had verbal abilities of a 6-month-old. He gained 6 years of language skills in 7 months while being overseen by an SLP, really pushing it. This is actually very special to me. One of the best friends of our staff members in Santa Monica, a very wealthy woman who had done everything for her child. The UCLA neurologist said she'd never read. And she used it for 8 weeks. This summer, she's a 14-year-old. She couldn't read A Fat Cat in June. And now she's telling her mom that she can finally know which one is the shampoo and conditioner in the shower. She can finally not just say, I'll have what she's having at a restaurant with friends, because she didn't want to say she couldn't read the menu. It's some incredible stories. Here in Spokane, we had a boy with Down syndrome gain 4 years of reading skills in less than 6 months. And this one was interesting. We actually wanted an academy, the Victory Academy in Portland, to pilot it, and the director there, Tricia Holbrook, she's posted publicly about it, so it's no HIPAA violation. She said, hey, could you try my 14-year-old son who's nonverbal? And we've had him in 3 months. 14 years old, nonverbal, that normally nobody moves that needle. And he's been approximating words, and it's thicker cement. The cement is hardening. You're gonna have to work it, but we're getting success. An exciting thing for us when we go globally is that in Cape Town, we're in about 7 districts. The Xhosa tribe is actually looking to see if they can use it to teach English as a first additional language. And the children have had tremendous success. So we're getting stories like this all the time. And one of the most fun ones with us, you may have even seen her story, and it's the next slide. This little girl, who they call the 5-year-old Monet, she lives in rural England, has beautiful pictures. She's been in every language, but this was an article that was run in CNN World 2 weeks ago. She was nonverbal in August when her mother called us because she saw the stories on Facebook. And after 6 weeks, she has a vocabulary of 50 words. Now she can say the colors. Now she can request paintbrushes. Fun for us, and it was interesting to see what happens when you really hit something on global. CNN hot-linked saying that Gemini is what she's using for speech therapy, hot-linked in their article. And our traffic was all CNN. Just if you read the paths in, it was just CNN, CNN, CNN. So the next slide, these are the institutions now that we're working with. Princeton did a study. We actually discovered it. We didn't know about it, but in our lit review for our next study, we found it. Princeton did a study with Toledo and Kentucky on whether or not they could teach teens with severe autism articulation and reading, and it was successful in doing that. The Portland State study is the one that I just shared with you. We're working with the University of North Carolina with the Carrboro-Chapel Hill School District. Yale is going to see with infrared imaging whether or not we are actually hitting the basal ganglia. Portland State's doing another study. We've got a secondary study going. I was just down speaking with the Commissioner of Education and Health in Texas on Thursday, and we're going to use the University of North Texas to see if we can come up with a fully collaborative model to roll out in all of Texas. And then Dr. Mobley wants to do a multi-site large study to see if we can improve Down syndrome articulation. That's his specialty. So he's very interested in whether we can do that for adults. So I know I have a short amount of time, but just closing the curtain back on that and just kind of coming back to Pullman, there's a reason you got that award. I didn't know about that award, but I go around to institutions and I sit in meetings like this and I always hear people saying, we're interested in innovation. Fundamentally, they're not. Because when you bring it to them, they're scared. And Scott's created a situation here as a leader where that's supported. And you could see it from the fact that 2 years ago, before I had all this, I wrote a letter to Kelly Siebold. And I didn't have letters after my name. I didn't have a degree in this. There was no reason for her to listen to me. But she read the email on her own personal time and had the passion to do that. And then she brought it to Carrie, the head of her department, who said, hey, if that works, she knows she has the support of her administration. She'll take the time, and she called her staff in and took that time to evaluate innovation. Again, it's a culture that allows that to happen and supports that. And then when she saw it, she acted on it. But at the bottom of her email, it says something that knowledge without without transformation is not wisdom. And so when she got the knowledge, she acted, and that's the rarest trait. So she acted, and she went to the management team here, and Ruben, and the fund writers, the grant writers that you had, and they actually wrote crazy idea right for a federal grant, and we got it. So just want to say my hat's off because of all the places I've traveled. This is a place where innovation is obviously a core, and it's supported all the way down so that your frontline therapists know they can take that risk. So I'm excited to work with you. Thank you.